we are taking additional measures to ensure that people stay at home. Consequently, with effect from tomorrow, 20th of April, an order prohibiting the movement of people in Edo State from 7 p.m. to 6 a.m. will be in force. This order will be reviewed after 10 days when we have increased screening and testing of our citizens. The security agencies, by this directive, are mandated to enforce total compliance by ensuring that movement is restricted at night.
Governor Obaseki said he established the COVID-19 response team on the 23rd of March 2020 and inaugurated an epidemiological study in conjunction with UBTH to predict and guide the course of action required to control the spread of COVID-19 in Edo State.
We decided to approach this crisis in the same manner that many other developed countries have done. Our approach is to use data and evidence to take the steps and actions which are required to flatten that curve so that we can reduce the incidence.
Governor Obaseki pointed out to win the fight against the deadly virus, the state government has trained 4,200 healthcare practitioners to man the screening, testing and treatment facilities in the state with safety and protection, including insurance and special allowances to motivate the workers. He also said that more than 500 officials have been trained to collect samples, while 2,000 men and women from the federal and state security agencies are helping to provide security for health workers.
Screening and testing is key if we are to understand and have the required information to control the spread of this virus. Therefore, our goal is to screen a minimum of 500,000 of our citizens. The first of the proposed 100 screening centers started operations last week in Oredo local government, where we already have reported cases.
The Edo State Governor said the testing center at the University of Benin Teaching Hospital is ready for trial tests under the guidance of the Nigerian Center for Disease Control. Governor Obaseki stressed that the government has increased its scope on surveillance, contact tracing, and line listing in all the local government areas in the state.
Many of our people still do not believe that COVID-19 is real, and therefore are not internalizing social distancing, which is required to end this pandemic. We have therefore organized our communication team to rally our people by undertaking massive awareness and raise the consciousness of citizens to accept personal responsibility to protect themselves and our communities.
Governor Obaseki said that the state government would continue to witness partial lockdown for now and not total lockdown because of the economic hardship total lockdown would create in the state. He said he has set up Edo State fundraising committee involving captains of industry, religious leaders and traditional rulers to help galvanize measures at mobilizing resources to assist the state government's efforts in building the required buffers to triumph over the coronavirus pandemic.
In order to cater to the educational needs of our children who are to resume school on Monday, 27th of April 2020, we have designed Edo Best at Home, which we have done in partnership with MTN. Edo Best at Home consists of interactive audio lessons with customized messaging, digital self-study, activity packs, mobile-based interactive quizzes, digital storybooks, and virtually moderated teacher-student classroom interactions.
The Speaker of Edo State House of Assembly, Mr. Francis Okiye, who recently tested negative, recounted his experience, while Chief Medical Director UBTH, Professor Godwin Obaseki, and Commissioner for Health, Dr. Patrick Okundia, also commended Edo State Government's effort in curtailing the spread of coronavirus in the state.
What I felt saved my day was because I started the treatment early enough. I got to know that it is possible The test was carried out even before I became symptomatic, and then some of the treatments came on. So I think that it is better to know your status and early enough.
The state governor emphasized the need for people to continue to maintain social distancing order and other directives put in place by the state government to curtail the spread of COVID-19. Patience Osarogiuwa reporting.